Once again, welcome back to Obstetrics and Gynecology videos. Today, we are going to see about unwed mothers, that is, unmarried mothers. Actually, this is not a common problem in India, but it's a common problem in European countries and in developed countries. An unwed mother is a lady who has become pregnant without legal justification of physical intimacy between man and woman. That is, before the legal marriage, if the woman become pregnant, we can tell that the woman is an unmarried or unwed mother. Actually, we know that our society is a traditional society, and in such societies, the physical relationship before the marriage, actually it is considered as a sin, and in case if the lady become pregnant, the society will not accept her. Now let us see the causes of unwed mothers. The main reason is the poverty. Because of the poverty, sometimes the parents may sell their daughters to other people, and unfortunately these young girls may become pregnant. That is one reason. And another reason, because of the poverty, these girls voluntarily or maybe due to the force of someone, they may get engaged in prostitution, and unexpectedly or as a tragedy, they may become pregnant. So prostitution means actually it's an act of getting engaged in illegal sex with the various individuals, either of same sex and of opposite sex. And if they are getting engaged with opposite sex, there is a chance for getting pregnancy. And another reason is teenage mistake. Sometimes due to curiosity or due to the inefficient capacity to take the decision, they may get engaged in relationship with the partners or the lovers, and that may end with the pregnancy. And another reason is improper sex education. Especially this will happen for the teenage girls and adolescents. And if they are having a partner or if they are having a love affair, sometimes they may get engaged in sex with the partner, and due to the lack of knowledge about the contraceptive methods and due to the lack of knowledge about the safe period, they may become pregnant. And sometimes this may happen as an emergency issue also. That is, sometimes it may be due to the after effect of a rape. So that is also a reason. Another one is contraceptive failure. Sometimes, even if the couples are using contraceptives also, sometimes the contraceptive method may become a failure. For example, if you are using the condom, we cannot tell that condom is 100% effective for giving protection against the pregnancy. There is a chance for failure. So such failure also may leads to the unmarried mothers. And actually, these unmarried mothers later they will face so many problems that we are going to see now. The consequences of being unwed mother. First thing, consequences of for mother. As per the Indian tradition, if a lady becomes pregnant before the marriage, she is supposed to face a lot of consequences from the society, because our society is not accepting the living together or extramarital relationship or the relationship, physical relationship or sexual relationship before the marriage. Our society is not accepting because it's a traditional society. So from the society, she may be supposed or she will get a lot of separation. And another one is consequences for the family. If someone become pregnant like that, this societal separation or social separation is not only for the individual, it will be there even towards the family members also. If someone become pregnant like that, their parents cannot face the society, their siblings also maybe in a position that they won't be able to face the society. Next one is economic problem. Due to the lack of support from the society, sometimes these girls, if they are working, they may not be able to go for the work. And sometimes from the family, if someone is working at the workplace, they may get the isolation, social isolation, and because of that they may stop the work, and that may leads to the economic problem. And another reason, already they may be having poverty, and though because of that poverty they might have engaged in some illegal sex or something like that. And when they become pregnant again, they are supposed to take care of an antenatal mother. We know that she is supposed to get extra food, and during the time of delivery, labor process is expensive, that expense is there. All those things will become a burden for the society, or a burden for the family. And later, after the delivery of the baby, they are supposed to take care of the child also. So economically this will become a burden. And another one is health problem. One reason, these mothers, they may not get proper emotional and nutritional support, and if they are not getting proper support during the pregnancy, that may leads to the nutritional deficiencies, and that may become harmful for the baby and for the mother also. And sometimes if it is an illegal pregnancy, they may hide the pregnancy from the society, and by hiding that during the time of labor delivery process, they won't go to the hospital, they will go for the unhygienic places, or they will go for the other delivery practices. That is, they may conduct delivery at home itself without the help of a doctor or without the help of an expert. And sometimes it may be in a hygienic place, and after the delivery they may try to harm the child, or they may throw the child somewhere. So these things will produce health problems for the mother and for the baby. And another problem is, if the mother is not having 18 years, if the mother is a teenager, her reproductive organs may not have proper development. So in that case, during the time of delivery and even during the time of pregnancy also, she will face a lot of problems. Next, support system available for the unmarried mothers. Actually, our society is not aware of support systems which are available in the society. And even if it is there also, these mothers are not having the habit of approaching the support system. Actually, in Western countries, they are having a lot of support system when comparing with the traditional societies. But every year, our government is also taking initiatives to improve the health status of these people. They are giving free food, they are giving free medical support, they are giving a job for the people those who are not having income, they are giving proper education for the children of unwed mothers. Even some of the posts, they are having reservation also. These children are having the reservation also, but majority of them are not aware of these facilities, and they won't take these, they won't use these facilities. So because of that, they will get the nutritional deficiency, and during the time of delivery they will not go for the medical care, and because of that they will get other consequences and other complications. Actually, if they are aware of this system, they can utilize it effectively, and they can have a healthy child and healthy mother. There are certain legal rights also for the unmarried mothers. They are having the right to establish the paternity. They can file a case at the court, and they can establish the paternity. And the father, who is the expected father of the child, is supposed to take care of him, and he is supposed to meet the economic requirements for that child. But at the same time, the woman is having the right to hold the child in her custody. Even if the child is in her custody also, it will become the responsibility of the father to take the expenses of the child. So these are the main legal rights of the mother. Now let us see how to prevent, or how can we prevent this unmarried mothers, or how can we prevent the occurrence of these pregnancies. One is peer education, that is giving proper education from the school itself, that is regarding the sexual matters, regarding the reproductive health, contraceptive devices, how to form the relationship. All these things should be properly explained to the teenage girls from the school itself. And next is sex education. It should be planned and implemented during the school period itself. And if they are having proper education about the sexual and reproductive health, the chance for getting engaged in the unresponsible sexual behavior is less. They will become more responsible, and they will start to take safe measures. And next is supply of contraceptives. Government can take initiatives to supply the contraceptives in the general places or at low cost, and it should be easily available for everywhere. Then to a certain extent we can prevent the occurrence of pregnancies in unmarried mothers. Then another one is abolition of prostitution. Actually, this prostitution is the main cause for the unwed mothers. So in order to prevent this prostitution, it should be banned, and prostitutes should be informed about the use of contraceptives also. Proper education should be given to the prostitutes also. Main thing, actually the countries should ban it. Next, we can see the role of a nurse in care of these unwed mothers. First role, she should act as an educator. She is having a vital role in the sex education for the youngsters. These nurses, especially the school head nurses, can go to the schools and they can educate the teenagers and youngsters about the reproductive health, sexual behavior, and contraceptive measures, all those things. Next, as an advocate, the nurse should stand for her right, and the nurses should give explanation about the rights. That is, she is having the right to establish the paternity, and she should explain what are the benefits or what are the rights she is getting from the side of government. Actually, she is having the right to give her child free education, and she herself is having the right to continue her education, and she is having the right to get free food and free medical facilities, all those things. So all this information has to be given by the nurse. And next, as a helper, actually she will be going through emotional and social harassment. So it is a responsibility of the nurse to support her and help her in order to overcome these problems. So she should help her to adjust with the society, and she should help her to get the free services which are available for her, and she should support her to get the governmental services, and she should make arrangements for getting the services from the government agencies also. And next, nurse should act as a researcher. As a nurse, it is the responsibility of the nurse to make research on the preventive measures to overcome or to avoid the unwed mothers. So thank you for watching this video. See you soon with a new video.